Hi, my name is Chad Denlinger. I'm with Genesis Systems. Today we're going to be demonstrating the key role that interoperability can really play in the process of a mother going through the process of giving birth. So we're going to take Jenny Chen, who's 33 years old, from her prenatal visits all the way through to the registration of the newborn baby and then her postnatal care. And we'll show how the interoperability can help her with some of the challenges that she'll face along the way. So our first presenter is Michelle with Oracle Health, who's going to start with Jenny at her prenatal visits.
Thanks, Mike. As he said, my name is Michelle Bruff and I'm with Oracle Health. And we're going to start our journey today with Jenny, who is a 33-year-old first-time mom in the third stage of her trimester, in her third trimester. Jenny is also a member of the deaf community, and while she can lip read, sometimes she does have challenges in understanding medical terminology when she's at her appointments. Jenny found me due to my experience in working with the deaf community, and she was pretty happy to discover that my practice leverages interoperability to access her care records from across the community. This has also been invaluable to Jenny's autonomy because sometimes she's not able to bring family members to her appointments to help her in communicating. Jenny's visiting me today for her final prenatal checkup. Leveraging Oracle Health's Immunizations Hub, I'm able to query and retrieve her previous immunization records from the state registry, which is being served today by SDC Health. I can see and hear that Jenny's kept up to date on her COVID jabs, which is really important as an expectant mom. And I also was able to see that she was up to date on some other important things. Now, I do see she's overdue for a couple, but for today, I spoke to her about her missing influenza jab, and she did agree to let me administer that. And for today's purposes, I have that already documented in the chart. Now, when I document this new vaccination, it's going to automatically report this new record to the state immunization registry. This is important for me because this means my staff are not going to have to be doing any manual reporting processes with the state registry. Now, there's one more thing that's relevant to Jenny's pregnancy journey. Earlier in her pregnancy, she was diagnosed with gestational diabetes, and that's what I'm showing you here. Now, this was initially worrisome for Jenny, but it's been well managed, so I don't have concerns with her plan to give birth in the birthing center that's closer to her parents' home. After concluding this final prenatal appointment, I want to make sure that the birthing center has a summary of key prenatal information, including that gestational diabetes diagnosis. I'm going to go ahead and create a direct message. I have that already staged here. And as part of this direct message, I'm going to attach a couple of different things. I'm going to attach a transfer of care document, and I'm also going to attach a pregnancy summary that's going to include important information like prenatal labs. When I send this, it's going to transmit securely to the birthing center that is on Epic. And with that, I'm going to transition over to Anna with the Epic team.
For this next part, I'm going to be playing the role of Dr. Green over at the birthing center before Jenny arrives. So as you can see, I've received a new direct message. I'll go ahead and click on it and review the attachments. So we received a continuity of care document from Jenny's OBGYN, and directly from this document, I can launch into the reconciliation process. So first, let's take a look at Jenny's allergies. We can see she's allergic to sulfa drugs, so I'll go ahead and add that to her chart. As you can see over on the left, this is now populated and it's highlighted in yellow. Here we have Jenny's medications and problems. So I'll go ahead and add that she's part of the deaf community. And as you can see over on the left of the screen, we've already indicated within Epic that she's going to need an interpreter for her visit. Additionally, you can see that gestational diabetes diagnosis, so I'll add that as well, and her pregnancy. Finally, let's take a look at Jenny's immunizations. We can see that flu vaccine that she just received at her prenatal appointment. So I'll go ahead and add that to her chart as well. Now I've completed the reconciliation process, so all of Jenny's information is ready to go when she arrives at the birthing center. A few weeks later, Jenny arrives at the birthing center and gives birth to a healthy baby boy named James. So now I'm going to be shifting my role and I'm going to become Wanda, the birth clerk. Here you can see my list of newborns that need to be registered, including our baby James. So in order to register James, I'm going to launch this Smart on Fire application, which will open up the Vital Resource Registration System. So as this starts to load, there's a lot of Fire queries that are happening in the background, which are pulling baby James's data from his chart into the registration form. And you'll see that populated in just a minute. So here you can see baby James's information, such as his date and time of birth, as well as some information about his mother and where he was born, automatically pulled into the registration form. One other piece I'd like to point out is here under risk factors, you can see that gestational diabetes diagnosis already pulled into the form. Everything's looking good here, so I'm going to go ahead and submit the registration form. And with that, I'll hand it over to Genesis to talk about the next steps.
Now that the birth clerk has submitted their record for registration via the EMR, they will log into the State Vital Records system to complete their registration. We're already logged into the correct facility. Opening the record, we can see that all the medical data has come through. In the Mother Medical 3 tab, we can see that the gestational diabetes that Jenny was diagnosed with has been properly sent to the state. With the required medical data populated in the state system, the only information left for the clerk to acquire is the socioeconomic and demographic data captured by the mother's worksheet. Genesis has a customer-facing website that can collect this data directly from Jenny Chen and her significant other. By bringing in the proper code, the state can directly import this data directly from baby's background. Under the Mother tab, we can see that the demographic data has come through. Now we'll go ahead and hit submit, and then we'll go back to the Vital Record system. We'll go ahead and hit refresh, and now we'll be able to see the education, race, and ethnicity information. Now that the record is complete, the clerk can go ahead and register the birth, and at this point, the certificate cannot be printed. This completion also triggers an extract to be sent to NCHS for reporting purposes. And now we'll pass the story back to Epic to continue the care of James.
Thank you. Now I'm going to go back to playing the role of Dr. Green. So now that baby James has been registered, let's shift our focus over to his clinical care. When James was born, I ordered some routine bilirubin testing, and the results came back and baby James had elevated levels. I wanted to focus on managing his bilirubin levels and continue to monitor them. So I'm using Utah's Smart on Fire application, which is specifically for neonatal bilirubin management. So as this loads, you'll be able to see how baby James's bilirubin levels changed over time. So as you can see, when baby James was just 2 days old, his bilirubin levels elevated, and they surpassed the escalation of care threshold, which is shown by the gray line in the graph. I administered some phototherapy treatment over the time frame that's highlighted in yellow, and as you can see, this treatment was successful as baby James's bilirubin levels reduced back down to the normal range. Now that Jenny and James have received the clinical care that they need at the birthing center, they're ready to be discharged. I know from speaking with Jenny that she plans to return back to the same place where she received her prenatal care. So in order to make sure that baby James's pediatrician has all the information they need, I'll go ahead and send a continuity of care document. Next time we see these two, they'll be over at James's pediatrician. So I'll hand it back to Oracle Health.
After Jenny returns home with baby James, it's soon time for his first appointment with his new pediatrician, who I'll be representing in this segment of the demo. Jenny's pretty tired from her first month at home with baby, getting a lot of sleepless nights. And so her delivery time with James is getting a little bit hazy. Here's where the benefits of interoperability can be shown again. Through direct messaging, I've already received the Encounter CCD from the birthing center, and I have that here in front of me. When I open that up, I can see that there is an attachment, and I'm going to look and I'm going to see that there is a transition of care document with a lot of really great information in here. Now I can review this, but what I'd really like is to be able to see this automatically ingested into my local record. That's what I'm going to show you now. Through Oracle Health's seamless exchange capabilities, we're able to ingest various clinical data concepts. I'm going to start first with James's bilirubin levels, so his labs. I can see that those were elevated upon birth, and so that gives me a little bit of concern, but I'm going to go and take a look at the problems now as well. I see that he had a jaundice diagnosis, and that has been resolved, which I'm really happy to see, and James looks like he's thriving. I didn't have to enter this into my local record because it was automatically ingested from that CCD that was provided from the birthing center. The next thing I want to take a look at is James's vitals. I want to see if he's doing well on his growth. The vitals that were provided in the CCD from the birthing center were also ingested into the record, and I also see the nurse already measured up James, and it looks like he's doing really well. So we have a pretty proud mama on our hands as well. The last bit I'm going to take a look at is the immunizations. Now, I would expect James to have received at least his first Hep B jab, and I do see that here on the record. Again, that was provided in the CCD that was provided to us. I went ahead and I had a conversation with Mom, and she agreed that we could administer that second Hep B jab, and so I have that already documented here on the chart. So after Jenny comforts James, we can now hand over to STC Health, who can talk about how they are supporting interoperability beyond the immunizations registry.
As we come to a close in Jenny's story, we find ourselves with Jenny and baby both extremely exhausted, both in need of some serious travel time. Jenny plans to travel back to her hometown to show off that adorable baby boy. In that moment, though, she's concerned. What happens if she misses one of her critical vaccinations for her baby James? Oh, she thinks. But again, now in that moment, she recalls that at the last pediatrician visit, she signed up for STC's MyIR product. Upon logging into this product, she's greeted with her immunizations, but more importantly, James's immunizations. And along with James's immunization is the ACIP scheduled forecast. What a sign of relief she feels. Empowered with this information, she's able to book her travel arrangements centered around his critical vaccinations. Throughout this entire journey, we've seen that through the interoperability standards, both provider engagement and patient have done cost savings as well as time saving. We appreciate all of you coming on this journey with us. Thank you.